It's hard to imagine a world without social media, and although it brings people together, there are risks associated with the streams of opinion and information available at our fingertips. Sue Saville visited the Royal Society of Medicine to find out about the challenges and benefits social media brings to our mental health and well-being.
Is it really only 10 years since smartphones came out? Now almost everyone has one, and most will engage in some form of social media, be it Facebook, Twitter, Snapchat, Instagram or other. Yet the harms and benefits are not widely understood. So the Royal Society of Medicine brought together key experts to assess the effect on mental health and well-being.
The average person checks their phone some 200 times each day and touches it at least 2,500 times. But while they're interacting on social media, what impact is this having on their mental health, both positive and negative?
At the negative end, there are real dangers when children can access inappropriate material like pornography, violence or anorexia websites. One expert, who is a cyber psychologist, warns that digital innovation does not create utopian cyber progress and that we should not confuse technology with the internet.
I started the apocalypse and work back. In other words, what could go wrong? Technology in itself is not good or bad. It's either used well or poorly by humans. At the moment, the internet is not fit for purpose for children. There is no shallow end of the swimming pool online. So as long as we confuse these issues, children will be exposed to content online that they should not be exposed to. And the solution lies in age verification. We specifically have to consider what is age appropriate online.
Evidence of the harms done to young people is only too clear to clinicians. They've seen a rise in depression, anxiety and self-harm in youngsters, which they associate with social media, along with bullying, sleep deprivation and poor body image. But they also see supportive websites and online communities, so say education is the key.
Social media is out there, we're not going to get rid of it, so we need to find a way of managing social media as effectively as possible, and as adults we need to educate ourselves about it, as parents we need to educate ourselves about it, and our children, the young people at school, they need to know that they can have conversations with their teachers, with their parents about things that are difficult and challenging.
Professional guidelines suggest that more than 2 hours a day of social media risks doing harm. A study by the Royal Society for Public Health on the impact of various social media platforms found that only YouTube came out marginally in the positive for providing information, creativity and community. The study made 3 key recommendations.
A pop-up on the screen when you've been on more than 2 hours, because that's a risk for mental health and well-being. Digitally enhanced watermarks on images that have been photoshopped or enhanced in some way so that young people know. And the third is around using the algorithms and ads to signpost young people who are struggling to help and support.
And help is out there. Many doctors themselves use social media to create supportive online communities, aiming to balance the more negative influences.
I find it fantastically useful. I'm part of a huge community of practice online with people both in the UK and around the world. It's just when the wrong message goes out, and it's really interesting hearing today, someone was talking about the positives and negatives of social media seem to be going wider apart. So we're seeing the positives even more, but the negatives even more, and there's no middle ground.
Delegates at the RSM gave their views.
I was quite struck by the grooming techniques that are used online, and also they talk about cyberbullying, or rather cyber abuse, and the reality of how much that affects people and how prevalent it is.
I think there's a risk that we often look at the negative side, but also I think there's a real chance to look at the positive side and see how we can embrace that to tackle some of the negative aspects of social media, turn it on its head a little bit.
And it's all about having to regulate it and make sure that we're teaching the kids the right things and that adults can actually act as role models to children.
The concerns highlighted at the RSM are gaining momentum. Next year, an all-party parliamentary group on social media and young people's mental health will be set up to address exactly the issues raised here.